Hello, welcome to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Each episode, we bring you a conversation with leaders across the healthcare industry, exploring topics ranging from new treatment techniques and interventions to novel service delivery methods and business models. And now your host, Rafi Salazar from Rehab Practice Solutions, a leader in patient engagement and retention strategy. Let's explore the possibilities of a new healthcare.
Well, hello again. Welcome to another episode of the Better Outcomes Show. I'm your host, Rafi Salazar from Rehab Practice Solutions. And let me ask you a question. Do you really know and understand the value that your healthcare service, technology, device, etc. creates? And if you do have a good handle on the actual value you create in the marketplace, in the healthcare marketplace, do you know how to adequately and effectively communicate that to various stakeholders within the industry? For example, doctors don't really care about the same things that patients care about, right? Providers and payers are usually at odds. Policymakers and regulators, again, different side of the coin there. So how do you do it? How do you take the value that you think you're creating, one, validate it against the market, and then two, communicate it in a way that positions it in a way that your prospective client, your targeted market says, you know what, that's for me. Well, if you're in that boat trying to figure that out, walk through that path, check out the Healthcare Positioning Alignment Workshop that we do here at Rehab U. Basically, what we do is we help you develop an effective value proposition by helping you answer the question, value to whom? Again, different stakeholder perspectives determine what they consider valuable and not valuable and things they don't care about, and the outcomes that they seek from healthcare services, from solutions, technology, software devices, etc. By narrowing down that value to whom question, you have a clear idea of how your technology, your device, your service, or your software is positioned to solve the problems faced by those targeted specific stakeholders within the healthcare industry that you want to sell your stuff to. If you want to learn more about how we do that, how we help you do it, you can check out the Positioning Alignment Workshop. That's positioning.rehabpracticesolutions.com is the URL. So positioning.rehab, the letter U, practicesolutions.com. Go check out the Healthcare Positioning Alignment Workshop and learn how you can say the right thing to the right healthcare audience to drive business metrics for your organization. Alrighty, moving on. This week, we are diving into, this is going to be just me, talking about and discussing the topic of data in healthcare. So I heard this maybe a couple weeks ago on a podcast I was listening to on a totally different industry, different thing in general. And it was an older, a retired NSA guy or CIA guy. And he mentioned this statement kind of in passing, and they just kind of rolled on into whatever the topic it was, like counterterrorism or something. And it stuck with me specifically as it relates to healthcare and some of the opportunities that I see. So this is going to be a little bit different format than what we've done. I've been experimenting here in 2024 with what we're doing. For this topic, I just kind of want to dive into the topic a little bit, share some thoughts about it, and then talk about some business ideas that I see, some opportunities that I see for the innovative entrepreneur, the creative thinker in the space to really move in and capitalize it. Someone that with more know-how than I, right? So what did I hear? What I heard was a statement that this guy said it matter-of-factly and kept on rolling with it, but it really stuck with me. And that phrase was, data is the new oil. And I thought about it for a second. I was like, well, what does he mean? Like, data is the new oil. Obviously, oil is valuable. And then he followed that up by saying, but unless it's refined, it's useless. So we're going to explore this a little bit. Obviously, in healthcare, if you've been involved in any kind of decision making in healthcare or sales, business development in healthcare, you understand that there's this underlying need for data, right? Whether you're managing a clinical operation and some of those KPIs you're using to drive decisions about operations and scheduling and service delivery, or whether you're on maybe the payer side or the business side and you're looking at revenue per visit and reimbursement and shared savings and savings rate and expenditure per insured and all that kind of stuff. Data is really valuable. The problem is, especially in healthcare, probably like in other industries as well, but healthcare is where we're at, so that's what we're going to talk. There's an overwhelming amount of data, and I believe part of this is healthcare organizations, whether they be payers, providers, policymakers in particular, are really notorious for this. They understand that value is important and that it's going to help them make a decision. So what they do is they just collect data. They collect any and every data point. And what you end up having is tons and tons and tons of data that is oftentimes across different systems, not uniform in the way that it's collected, in the way it's organized and categorized, and relatively useless for the people that are wanting to use it to make decisions. So let's back up here. I'm going to talk about the data as the new oil, the value behind it. We'll take a dive into the opportunities that I see in data in analytics and like data infrastructure within healthcare. Maybe look at some of these ideas of like maybe data analytics as a service or something like that, and really explore how I see this. Again, this is like the launching point into a conversation. I am not the end all be all here. This is me just kicking around this idea. So when I was thinking about data as the new oil, and specifically as it relates to healthcare, I came up with a few points or topics that are worth considering when we think about it. So I'm just going to name them all, and then I'll kind of dive into a little bit of each, maybe just like a 2 or 3 second summary or minute summary of each, and then we'll talk about the topics that are relevant here. So here's one of the main points, and I kind of alluded to this earlier. So healthcare data has a lot. It's abundant. It's relatively abundant. Not relatively. It's just people are collecting data about everything. Like oil, data is abundant, especially in the digital age, because it doesn't cost a lot to store it. It doesn't cost a lot to gather it either. And it has immense value when it's processed and refined effectively. That's point one. Point two is the economic power of that data. So just like oil, without getting like too political or anything like that, oil-rich countries have grown in a lot of ways that oil-poor countries have not, right? They get a lot of leverage when it comes to negotiations for trade agreements and deals. And I mean, just look at like the US dollar, for example, has almost been, some folks will say, propped up by the fact that it's the reserve currency for oil deals and stuff like that. Oil has been the driver and the conduit for a lot of geopolitical power in recent years, and it's fueled a lot of economic growth. The same thing can be said, or will be said, I imagine, of data in healthcare, because it fuels the digital economy, right? If you know and understand the data, you can make a lot of decisions that either give you a competitive advantage over other players in the market, that helps you drive policy in a way that is beneficial to you. It helps drive, again, business decisions, economic development, you name it. I think data is going to have the organizations, and hopefully not government, but the organizations that know how to wield data in a lot of ways are going to be the organizations probably over the next 15 or 20 years that drive a lot of policy and economic growth in the economy. All right. So the first topic was, okay, abundance, the abundance of data. The second was the economic power. The third would be monetization. So how do people make money from the data, right? So companies can extract value from data through various means, right? You've got analytics, you got data visualization is huge. Like how many companies, healthcare organizations, provider organizations have paid a consulting firm or a software firm to build them like a data dashboard, whether it be a service delivery dashboard, a clinical services dashboard, a revenue projection or billing dashboard. Dashboards are big, right? The companies that have made money over the last years, a lot of money, have been companies that have been able to take the data that providers already have and convey it to them in a way that they can use it to make decisions, that data visualization. Um, insights that you can generate from data, whether it be for research purposes or business purposes or investment purposes. PE firms that have analysts on staff that are exploring various trends in the healthcare industry and how they can leverage that to get ROI on either whether it be acquisitions of provider organizations or investment into healthcare technology, and the like. Much like oil companies monetize their oil through extraction, refining, and sale, the opportunity is there for healthcare companies, innovators, and entrepreneurs in the space to monetize data, whether it be data from their own organization or data from client organizations, as a way to benchmark, outcomes, for example, or revenue goals or projections or something like that. There's ways to monetize that data, and it's not very apparent sometimes, which we'll explore in a little bit. The fact that abundance, economic power, monetization. What about the strategic point of it? Is it a strategic asset? Yes, I would argue very much so. So data has become a strategic asset for organizations, especially healthcare organizations, similar to how the control over oil reserves has historically been a strategic advantage for various nations, like geopolitically. We want relationships with this country, for example, because they have a lot of oil reserves, or we don't want to make this country mad or get engaged in some sort of combative relationship with a company that could really, or a country that could really injure us when it comes to the flow of oil, right? I don't see it being like so much of a geopolitical weapon, healthcare data, because a lot of it is going to be based off of the different systems involved, right? Like, for example, I've done some work with healthcare technology companies that are maybe they're based in the UK or they're based in the United Nations, and they're wanting to make a break into the US market. A lot of the data that they have does not translate very well on the business side, does not translate very well into the US market. And part of that is because the way that our markets are structured, right? Single payer systems just have a different set of incentives, a different employment of technologies. And the US being this third party payer system where there's this mix of private pay and insurance reimbursement and all of the dichotomy that goes in there about fee for service and all of that, it just makes some of that data not as useful or not as relevant, right? It's not as generalizable. If you're using this technology that would be unreimbursable here in the United States over, like, let's say in the UK, and you've got all this usage data, and this is how the typical course of care implementing this tool or this technology looks like this, well, that's not going to translate very well into the United States, right? Because we're going to have to rethink how it's deployed, how it's employed, how it's billed for, all of that, the adherence. So I don't see it being like data being a strategic asset that's used politically in any way, but it can definitely be and should definitely be looked at as a strategic asset for healthcare organizations operating within a specific market, right? Like big healthcare systems within the U.S. automatically have an advantage, or should have an advantage, because of the access to data that they have for maybe a specific geographic region, for example, based off payer mix, demographics, diagnoses, you name it. That data can be and should be used strategically to make those business decisions, and it's going to drive a lot of those maybe acquisitions in the future, partnerships in the future, things like that. And then there's the idea of privacy and the ethics around data. So obviously I mentioned it earlier, but it does not cost a lot of time or money or effort to collect a lot of data. So then the question gets raised about the ethical use of that data. Let's say we're completing intake forms, we're doing all kinds of stuff, we're collecting a lot of data. Now, obviously, there's regulations in place, HIPAA, for example, being like regulation at the federal level here in the U.S. about how data is shared and used. But even within the organization, there's some ethical questions about how do we use the data within the organization. Maybe it's for like marketing new healthcare services, or maybe it's for driving business to a different department or another strategic purchase that the healthcare system has made, for example. And we have this list of patients now that we can market to or that we know might need the service and all of that. It raises some ethical quandaries, and I'm not going to answer any of them because I'm probably not smart enough to answer any of them. It's one of those things that we're going to have to it will take place, like these discussions are going to take place probably in the public sphere over the next, I don't know, decade or so, as our ability to refine data, to use data, to manipulate that data becomes much more advanced and much more accessible, which I'll talk about in a minute. That I see some of the opportunities being that technology is making it easier for us to gather some of this data and then to use it effectively. And then there's a whole issue of privacy and the protection of that data. I'm recording this right now in March of 2024, March 15th, and we're about 3 weeks into the Change Healthcare cybersecurity incident, which if you're not in the US and you haven't been tracking with it, or you've just been in a part of the healthcare industry that hasn't had to deal much with it. Change Healthcare, which is a huge claims clearinghouse, among other things. They process a lot of prior authorizations, prescription drug authorizations, medical bills and claims. They do a lot. I think the last article I read said that Change Healthcare at one point in time was processing upwards of 50% of the medical claims in the United States. So huge organization. It's part of United Health Care Group, so they're not, or United Health Group, so they're not a small company by any means. And they experienced a cybersecurity incident where I believe it was somewhere in the neighborhoods of 4 terabytes worth of data was captured and held ransom by a criminal organization. And as a result, when Change became aware of the breach of their systems, they do what is standard operating procedure, I've come to find out, in the cybersecurity world, which is if you know that a system is compromised, you unplug everything to it, which meant claims, authorizations, medical bills, all of that kind of stuff, benefits verification and eligibility portals, all of that stuff just went offline. And it's because Change was trying to prevent that that security breach from spreading throughout their system. Well, what that meant was that the entire, and in some cases, entire provider organization groups were left without money, where they weren't able to process claims, which means they weren't going to be getting paid. And what people don't realize about healthcare, especially in the United States here, is it's a very cash flow dependent business. If you go without money for a month, most healthcare providers are going out of business, or they're going to find it very, very difficult to keep their doors open and keep providing the same level of service. At the same time, there were patients that were not getting access to surgeries or surgical procedures, medical procedures, because of prior authorization that they weren't able to get. Prescription drugs, in some cases life-saving drugs, that were not being issued because they weren't able to verify services or verify authorization or verify coverage and stuff like that. It's a very, very big deal. And again, this is Change Healthcare or Change Health, part of United Health Group. Like, this is a big, big company. You would expect that a big, big company would have had things in place to prevent something like this, right? Now, I'm not going to point fingers and blame or anything like that, but if a giant organization, maybe they were targeted because they were giant, we're not going to get into that here, but if a giant organization with a lot of resources to point towards cybersecurity had a breach like this, it means that a lot of other providers and a lot of other organizations are probably at the same level of risk, if not more, at risk. So the idea about leaning into data in healthcare means that obviously there's the ethical consideration about how we use this data, but then the privacy and protection. What needs to be in place? What should be in place? What's best practice? All of that, we thought anyways, was squared away. We had HIPAA, we had the security, we had cybersecurity, we had the firewall, we had the IT people were doing their IT thing, right? And now it's becoming more apparent, especially through this thing over the last 3 weeks where you've had really large portions of the healthcare industry brought to a standstill, that we need to rethink some of how we go about securing and keeping safe people's data, patients' data, or provider data. So, anyways, that's kind of some high level thinking that I'm doing about this topic, and maybe we should all be doing about the idea of data in healthcare, the use of data and the leverage of data in healthcare. So, let me back it up now, and we're going to take a look at some of the benefits that I see of data when it's leveraged appropriately. And I know I've done videos about this. We've done articles about this on the website. We've probably covered this a little bit on the podcast in various spurts. And then some opportunities that I see. So I know I've said this a ton, but the main value driver for many healthcare technology, SaaS companies, devices, even provider organizations is the data. Because when the data is leveraged appropriately, it provides the opportunity or creates the opportunity to do a few things very well. One of those would be reduce the cost of delivering care. And it can reduce the cost to patients, to providers, and to payers, whether that be through increased efficiency, improved clinical outcomes, or evidence-based practice that decreases the need for treatment, which decreases the cost for providers and patients. You can make the argument about the increased efficiency reducing the cost of care to provide organizations, which means they're more profitable, or that it increases their access and then they're able to see more patients, which again leads to higher profitability. You've got the ability to improve clinical outcomes, which immediately helps patients and payers, right? If patients are getting better more quickly, then obviously payers are paying less. Patients are increasing their quality of life quicker. Maybe they're experiencing less dysfunction. They're spending less on healthcare delivery and then on all the other associated costs that come with receiving treatment, like taking time off of work, lack of productivity, economic productivity of their job or whatever. So there's some immediate benefits there. And then the third area that data can really help us to improve is to identify and capitalize on areas within the organization, for example, for improved financial performance. And this is really for payers and providers, right? And this has been done to some extent, but I want to take the time to kind of explore each of those 3 points a little bit and then talk about those opportunities, because they're all kind of the opportunities that I see with data in healthcare, leveraging data in healthcare involves improving or affecting these 3 things. So by reducing the cost of care, the cost of delivering care. Now, obviously this can save money for patients, for providers, for payers, but how do we get around doing that? A lot of that is leveraging the data that the organization, maybe the provider organization, has around some of their operational metrics. So maybe it's around the number of units being billed, or maybe there's a scheduling optimization piece that would allow the organization to see more patients. Or maybe it's a matter of looking into what's available in the research, but then their own data of maybe positive cases or something like that. Chip and Dan Heath talk about finding the bright spots and then working, like reverse engineering your way from the bright spots to a solution. And if you have some of those bright spots in the data, you can reverse engineer your way to discovering or building out maybe a system or a process that makes it more efficient to deliver care. So when I think of efficiency, I'm thinking like how services are either scheduled, delivered, the staff that is used to do so, the time that is used to do so. For example, I was working with a company a while ago that was developing a screening tool. I'm not going to get too into the weeds about it, but it would have essentially used the smart, and I think we've talked about a couple groups like this on the podcast. Use a smartphone or webcam or something like that to do a rough movement screen, and that rough movement screen would provide preliminary information about maybe musculoskeletal function, maybe it's balance, maybe it's gait, stability, range of motion, whatever. And it would then give the recommendation to the patient or the user. You need to see a orthopedic surgeon, or you need to see a physical therapist, or you need to do these exercises, work on these muscles. Using a tool like that from an efficiency standpoint to screen out patients that might not be a good fit for your services or for provider services, or that might screen them into a lower cost service, can be very, very, very beneficial. Now, we'll talk about it in the future. Like, I know that there's things about the regulatory impact. I was just having this conversation with somebody on LinkedIn about the regulatory impact of using like AI and algorithms to make clinical decisions versus as using them as clinical decision making aids. And there's a big distinction to be said there. And there's a huge regulatory impact of how it's done. But leveraging technology to reduce the level of care, maybe, or to drive patients to the most appropriate level of care, can reduce the cost. The same thing can be done using data, right? Like, given these inputs, given where we're at currently, given, this is the diagnosis, the treatment course, where the patient's at now, we can screen them into the most effective treatment for that patient. That's something that's going to decrease the costs of delivering care, because instead of wandering down another path or maybe going to a super expensive specialty, you're able to send them to something that's going to cost less for the patient and the payer, maybe even the provider as well. So leveraging data to reduce the cost. Improving clinical outcomes. The way you can leverage data on that is really by, again, reviewing the recent literature, which is wonderful, but then looking back through your own, the provider's own data and saying, okay, I'm going to talk about physical therapy, occupational therapy here, because that's the world that I live in, musculoskeletal health, right? Let's say I run a physical therapy clinic and we saw, 700 patients this past month. That means over the past quarter, we saw 2,100 patients. That's a lot of data points. Let's say, for the sake of argument, all of them, let's say 2,000 of them, were total knee replacements, patients that were coming to physical therapy following a total knee replacement. What you can do, or what data allows you to do, whether you have the ability to do it or not, and that's one of the opportunities that I see here, right? That's a foreshadowing into the second part of the show. But if you were able to look back through all of those 2,000 patients over the last quarter, and again, I'd like Chip and Dan Heath say in their book, Switch, if you're able to go back and look at those bright spots and reverse engineer, okay, 37% of our patients or 30% of our patients needed only 8 visits of physical therapy before they discharged with independence. Meanwhile, the other, 70% were somewhere in the neighborhood of, 10 to 16 visits or whatever. You can look back at those, the 30% that did really well, that performed very well, that got better faster, and say, okay, what did we do that allowed that to happen? Was it a patient-specific factor that we have no control over? Or more likely than not, and I think the research would bear this out as well, there's some kind of operational thing that's happening that is causing that increase in length of stay, right? Maybe it's the type of service or the treatment approach. Maybe it's the method of delivering. Maybe it's something that was employed, like remote therapeutic monitoring or hybrid service or something like that, where the patient didn't have to come into the clinic as much. Whatever the case may be, you look through that data and you say, okay, well, we know that 30% of these patients were able to get better and discharge in half the time, whatever it was. These are all numbers I'm pulling out of my rear here, so don't take them like I'm not talking about these numbers as real numbers here. I'm just using them to illustrate a point. If you can reverse engineer the ones that did better, then you can look back at all your other patients and say, okay, going forward, we're going to do a little trial here. And every patient that comes in, we're going to try this approach with, or we're going to do X, Y, Z with, or operationally, this is how we're going to manage their care. And you, over time, again, looking back, maybe you do that for a quarter, then you look back at that quarter and you say, okay, was there improvement on this number, this KPI that we were looking at? Maybe it's length of stay or something like that. The ability to look back on your data to one, make decisions, and then two, go back and check to see if those hypotheses were correct, could really improve those clinical outcomes at the organization, meaning that the patients are saving time and money, the payers are saving money for each individual patient, and arguably you're increasing the capacity of the clinic, which means now they can see more patients. So they're not going to be, cutting their leg off and losing a bunch of revenue because they're not seeing patients as much, but perhaps they're seeing more patients or something like that. They're increasing access. So number two, improving clinical outcomes. That's just an easy way that I see data helping. How about identifying and capitalizing on areas for improved financial performance, whether it be for payers or for providers? Again, I'm going to talk about the provider side of things, but you can also make the case for payers as well. Providers, for example, maybe you can look back on your data if you have access to the data and we're collecting that data. Surely you're collecting it in your EMR. The question is how you get access to it, which we'll talk about later. But let's say you have, again, you're seeing 700 patients a month, so 2,100 patients a quarter, and you can look back over the data and you should be doing this, from a profitability standpoint per course of care or per patient encounter. Let's say you're doing that. And you see an area where maybe it's a population, maybe it's a referral source or referring provider, or maybe it's a mechanism of injury or some factor that you see that, okay, every time we see a patient that meets these criteria, we are maybe they're getting better faster. It's a higher profitability for us in that course of care, or the revenue is higher per visit, whatever it is. Then from a business development standpoint, you turn around and say, okay, how do we, like Chip and Dan Heath say, I'm gonna mention them a lot because I think the book is awesome. I read it a couple years ago and I just reread it and I thought, man, this is great. So Switch is the name of the book by Chip and Dan Heath. But you notice maybe this bright spot. Okay, every time we see a patient with status post reversal shoulder replacement and we treat them in this way, they get better faster and our increase, the margin per course of care goes up by X percentage of points. Well, then that allows you to capitalize on that. It means you either go to that referring provider and say, hey, listen, every time you send us a patient with this diagnosis, status post maybe reversal shoulder replacement or something like that, these are the outcomes that we're able to provide compared to the peers, or the national average or whatever it is, which helps drives referrals. Or you can say every time we see these types of patients, we make more money or whatever it is. So now we're gonna shift our business development focus to getting more of those types of patients, or maybe we're gonna expand our service offering into this area of practice, or maybe we're gonna open up a location using the data for location and growth. I was talking to somebody the other day who said that they had a client who is a provider organization, and they pulled the data for all of their patients in the last 8 months or something like that. Then they took a look they stripped out all of the data, the demographic information. What they were really looking at was payer, the revenue or the margin, the profit margin for that patient, and then the geographic location. So then what they were able to do is look at all of their patients. They were looking at expanding. So they looked at all their patients. They said, okay, let's say Blue Cross is our biggest payer or our best payer. They reimburse the highest rate for us. They looked at all of their patients and they just screened where's the biggest concentration of our Blue Cross patients. And then they said, okay, we know where that is. Now let's look at the biggest concentration of our most profitable patients, and then our patients that had the best clinical outcomes. I think it was the three things that they were looking at. And they basically looked at the map of where all of these patients were coming from. And they noticed that it was, 10 miles away. I can't remember the number, 10 miles away or whatever. And there was a spot, there was a suburb of their city where they had almost a convergence of all of those three things. So that's where they opened up their next clinic, right? Right? And they knew that they were going to be reimbursed higher because they were in a place that had a higher, there's a concentration of their highest paying payer. They knew that the patients there were going to fit their demographics that they wanted, whether it be that they were the most profitable or whatever, and then the clinical outcomes or whatever. So they used the data to make a decision that really impacted their business, because it wasn't even like, we're going to make this operational change that increases revenue per visit. It was, we're going to add another location, and this is where we're going to expand. We're going to use the data to drive the expansion, which is awesome. So those three things: reducing the cost of care, improving clinical outcomes, and then identifying and capitalizing on areas for either improvement, business expanse, financial performance, you name it. So the question is, well, how do we use that? Or like, how does data get used to achieve those three things, right? Reducing the cost of care, improving clinical outcomes, and then driving business metrics and expansion and things like that. This is where I see probably the biggest opportunity. And I mentioned it at the beginning, but it all revolves around data analytics and data infrastructure. So we'll talk about the analytics piece, and then we'll talk about the infrastructure piece, because I think the exciting thing for me is seeing the infrastructure piece. But we'll talk about the analytics first. I kind of alluded to this at the beginning, but data analytics in healthcare has been big for a while. In fact, I know a guy who was, I think they went through Series C at a big technology company, healthcare technology company, that was really just a data mine, or a data warehouse for some big healthcare organizations. Data analytics has been big for a while because, again, I've mentioned it over and over again over the last 30 minutes or so, that people know that you can make a lot of money if you understand the data in healthcare. However, the average private clinician-owned practice never really has had the access to the kind of data, analytics, and visualization that's available to big, large hospital systems, right? A giant healthcare corporation that has hospitals all over a region of the United States, or maybe across the country, just has an operating budget, one where data analytics becomes a necessary piece of effectively managing that business. But really, it's one of those things that has been really expensive. You have to pay a big consulting firm or a software development firm to come in and build a specific or a custom piece of software or data analytics tool for your version of Epic or something like that, right? It just has cost a lot of development time, resources, training, you name it. Technology is making data cheap, and not that data is not valuable, but the data is now accessible. And what I mean by that is, there are companies that are going to be formed. There are companies that are formed now, I'm sure, but that are going to be formed over the next 5 years that are going to make tons and tons of money. And the way they're going to do it is by leveraging the technology capabilities that large hospital systems and large healthcare systems have had for the last few years, and making that available to privately held or smaller, maybe regional or rural hospital healthcare systems and private practices. Much the same way that if you think about what I was talking to Jimmy from PT Pintcast, had him on the show a while back, and he talked about the metric shift that happened when he realized, he was in radio, and he realized that the smartphone was going to totally change the way media was bought and sold. Because now you didn't need a big syndication, you didn't need this big media company. Anybody with a computer and an internet connection, this is a great example, right? Anybody with an internet connection and a computer can make a podcast, can create content, can make that available. Not that it's going to be that easy because of the regulations and things in healthcare, but some of those tools are going to be very easy and accessible if you know what you're doing. If you're one of those computer people that can build it on the back end, which goes back to the infrastructure piece. I'm thinking of some companies already that are in the PT/OT space, where I spent a lot of time, that are already using a provider's data of like functional outcome measures or something like that, and helping them make business decisions and marketing decisions based off of that. Imagine something like that, except way expanded into that organization. Maybe it's like a plugin that you can put on your cloud-based EMR that helps you dive through the data and really gives you a good picture of what you're doing operationally, clinically, et cetera. And that's awesome. So data analytics, and then the ability to take that data and then make it visual via a dashboard or something like that. So clinicians or clinic managers or practice managers can make decisions off of. So a big area that I see for opportunity from a business standpoint is creating or building a company, a software that helps those smaller, the average, privately held, clinician owned maybe practice get access and leverage the data that they've never been able to use before. They have it, they just haven't been able to use it because they haven't had, $100,000, $200,000 to drop on a development firm to come in and build them their custom Epic data visualization software, right? As technology makes some of that stuff more accessible and cheaper to do, you're going to be able to build a company around delivering that service to healthcare clinics that are really going to want it. It's going to be valuable to them. I think what I mentioned some of this in a LinkedIn post, and kind of my follow-up thought to this was like, artificial intelligence, technology, and software are now making access to those types of services, that data analytics, data visualization, more affordable than ever in other industries. So now it's just a matter of taking some entrepreneurial person, taking that idea and shifting it into healthcare and really targeting, like I said, those smaller, privately held organizations, clinical organizations. Maybe consider it data analytics as a service, for example, because again, the value is in the data, and if you can deliver it as a service to those organizations, you will make money. But then those organizations are going to see it as an invaluable tool. It'll make you one of those things that, one of those softwares that are expenses or investments that when the budgets get tight, they know they can't cut because they need it, right? So it's the building blocks, in my opinion, of like an interesting and then a lucrative business. Yeah. The other thing and the other area, and I didn't expand on this all that much in the LinkedIn post, was the idea of the infrastructure piece. I'm gonna take a sip of water here. The infrastructure piece. So all of the things that I said are really cool. Data analytics as a service, giving or providing some kind of software or tool that allows privately held clinicians to leverage their data. That's all awesome. The other really cool piece is like the fundamental building block of that, which is the infrastructure that provides the ability to leverage that data. So I heard somebody say again on another podcast that I was listening to a while back that artificial intelligence infrastructure is going to be the next, gazillion-dollar marketplace or something like that. And what the guy was talking about was that we have artificial intelligence, we have algorithms that are making decisions that are helping, improve logistics, do whatever it is. The companies, though, that are making a ton of money currently, at least he was saying this, I have no way of verifying this, but it makes sense intuitively. The companies that are right now making a ton of money in that space are not so much the companies that are providing the actual service, but they're providing the building blocks. Maybe it's the APIs, maybe it's the actual code on the back end that's running some of those programs, because that is really using the artificial intelligence, the algorithm, whatever, at its base. So at one level you have, okay, we have this data available, we have the software available that makes, analyzing this data, this healthcare data, very very beneficial, affordable, accessible, and you can use it to make clinical decisions. We're going to package this and sell it to a healthcare organization or a provider organization or a payer organization or something like that. Behind that, though, the level behind that is the actual company building that original software. So not just leveraging it and packaging it for healthcare, but actually being like the person standing there during the gold rush that's selling picks and shovels, right? And I don't know. This is way out of my depth, so I'm not going to talk like I know anything about it. It's just an interesting topic to me. The infrastructure to leverage artificial intelligence and algorithms, right? Like let's take Chat GPT as an example. Like Chat GPT, that whole tool is now being used, and people are building companies based off of it, right? We had Matthew Curtis from Insight Voice on the show talking about knowledge translation and content creation, and the company that he has built leverages the ChatGPT API, I believe is what he said. Correct me if I'm wrong, Matthew. Write in with some hate mail. And his business is it's a platform that allows people to create content, experts to create content, and a lot of what's driving that is ChatGPT, right? There's going to be something similar in healthcare. Maybe it is ChatGPT. I don't know. But the companies that are selling a lot of data visualization, a lot of software, some of these software solutions have an underlying algorithm that's working. And that algorithm, in my mind, is like the infrastructure, right? Like building that is the really valuable piece. And then if you can take that and sell it to 10 different software companies or 10 different solutions providers, you're basically building in that business is their business is gonna be dependent on your business, which gives you kind of a moat from a competitive standpoint. And that's about all I'm going to say on it, because I lack the understanding from a technological standpoint or the tech standpoint to be like, oh, and this is how it works, the infrastructure of data processing. I just think it's something that's very interesting. And if you are listening and you are involved in that and you want to come and talk with me on the show about it and enlighten me about the infrastructure of data analytics in healthcare, reach out, because I'd love to have a conversation with you on the show and figure out the pieces that I'm missing. I know it's one of those things, like when I think about like, okay, the infrastructure that's going to be used to deliver some of these awesome things that AI and data and technology are going to be able to deliver to healthcare. I know I'm missing some pieces, partly because I don't know how it works. I'm not a computer guy. I'm a clinician by trade who turned into a business consultant and a management consultant, and I've been doing that for years. So I'm missing the technological, the techie background. So anyways, shoot us an email, info@rehabupracticesolutions.com, or go to betteroutcomes.show and fill out the form and just say, hey, I'm that expert you were talking about. I'd love to have a conversation, and we'll get you on the show. So there's that. That's all I've got this week, folks. If you like the show, head on over to iTunes, leave us a rating and review. But more importantly than that, just share the show with somebody you think would find it valuable or insightful or entertaining. Do that, and we'll be good. Until the next time, folks, be safe, be healthy. I will talk to you then.
Thanks for listening to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Our hope is that you walk away from each episode informed, equipped, and empowered to push the boundaries in your own practice or business. We want to give you the tools to help you build strong, long-lasting relationships with your patients and clients, helping meet their goals, improve their health, and achieve better outcomes. Learn more at www.rehabupracticesolutions.com. We'll catch you on the next episode.